During Khalif Browder's time at Rikers, he struggled with depression and suicidal thoughts stemming from his incarceration. He attempted suicide multiple times.
He died today in Los Angeles at 75, an apparent suicide.
Into his apartment and have found his body. His reps have confirmed that he did take his own life.
Sean McCarroll wrote a few messages on social media prior to taking his own life.
I just think that it's conceivable that somebody would say it's too much to take and I don't want to do this anymore.
May is National Mental Health Awareness Month, and y'all, we really have to have a serious talk about suicide in our communities.
Yeah, even though it's not as prevalent as other mental health issues, it has become increasingly more present in our community.
Among adults, suicide attempts for Black men have recently surpassed other races.
And this is not just a grown folks thing. So the latest research shows that for the first time ever, the rates of suicide for Black children have doubled and even tripled for certain methods for Black boys.
Yeah, in fact, suicide is the third leading cause of death among Black people ages 15 to 24.
The rates of suicide are even more bleak for our family members in the LGBT community.
So how do we recognize the key signs of suicide in ourselves and others?
Well, the first thing you got to know is that there are different levels. So a person can have suicidal thoughts, language, feelings, or urges, near suicidal behaviors like cutting, and or a specific plan to carry out an attempt.
When attempts occur, men and women may use different means, which often results in more completed suicides for men.
Yeah, so signs like I wish I wasn't here,
Increased alcohol and drug use,
aggressive behavior,
social withdrawal from friends, family, and the community,
dramatic mood swings,
talking, writing, or thinking about death,
and impulsive or reckless behaviors are all things that we should be looking out for.
90% of folks who die by suicide have a mental health or substance use disorder. So a lot of the signs we just mentioned are symptoms of mental health problems too.
Well, what can we do?
First, it's important to understand that suicide is not a matter of being selfish or weak. We don't know everything about suicide, but we can say it's very complex, and for folks who are in a lot of pain, may feel like the only option.
Yeah, we also know that sometimes folks who have suicidal thoughts and plans can look and feel better for a bit and later make an attempt. So be sure to support folks through their continued health.
If you are really struggling, it may be a good idea to create a safety contract. That basically means you would agree to not hurt yourself and to call someone you trust when you're feeling the urge to do so.
And finally, if you or someone you know is ever in an emergency, please call the National Suicide Prevention Hotline at 1-800-273-TALK or 911. I'm Ree.
And I'm CT, and this is our Mental Health Minute.
Come on. I see no changes. Wake up in the morning and I ask myself, is life worth living? Should I blast myself?